In tonight's Be Healthy, we're hearing a lot this summer about whooping cough. The number of cases has skyrocketed in the U.S. and in Connecticut. We don't have an outbreak, but we are nearing a 10-year high. It's easily preventable with a vaccine, but there are some newer recommendations on who should get it and how often.
Here, you can go back on and I'll push you.
Little Evan is almost 3 years old, and he's been vaccinated against whooping cough. His mom, CARA, once suffered through the contagious disease.
The protracted, terrible cough, and it lasts for about 6 or 8 weeks, so it's really not fun to have.
Little Liam's mom had reservations about another vaccine, but didn't want her toddler to get whooping cough and possibly die.
I wanted him to be safe and not be sickly, so far so good. He hasn't had any type of reactions from them, so pretty good.
Whooping cough can be deadly, especially for the youngest children. There are deaths each year.
Dr. Paul Skolnik is an infectious disease expert at UConn Health Center. He says that while the smallest babies are most at risk, they're not the only ones who should be vaccinated against whooping cough.
It's become apparent that we have to revaccinate the older kids, 10, 11, 12, which is another pocket of increased incidence, and then adults.
That's right, adults. Dr. Skolnik says it's now stressed that parents and caregivers also get vaccinated to prevent a whooping cough spread or epidemic. What parents may not realize is there is a new formula for the whooping cough vaccine. The old one lasted 8 to 10 years. The new formula, 2 to 3 years. As a result, Dr. Skolnik recommends adults get vaccinated for whooping cough when they get a tetanus booster. According to the CDC, the U.S. has its worst whooping cough outbreak in 50 years in 46 states, including Connecticut. Since July, U.S. cases have risen to 22,000, double last year. Here in Connecticut, 111 cases have been reported, up from 68 last year, with no known deaths, according to the State Department of Public Health.
But anyone can get it and spread it, importantly, and that's why we want to get the vaccines to everyone.
And the state is offering the whooping cough vaccination to pregnant or new moms free. And some news you can use: the state will be allowing pharmacists to start giving the vaccinations for a cost in October.